To the first case, an 8-year-old boy was brought to the hospital with history of chronic cough, retarded growth, burning micturition, diarrhea with passing of foul-smelling stools, inability to read in poor light and dry and thickened skin. On examination, the boy was malnourished, grayish-white spots were seen on the conjunctiva and the conjunctiva was dry. Now looking at the clinical presentation and the examination details, we can conclude that the key catchy point is that the malnourishment of the child and grayish white spots on the conjunctiva and dry conjunctiva. The others are the associated signs and symptoms which can help us in the diagnosis of the case. So what is the case? Probable diagnosis is the vitamin A deficiency leading to various presenting signs in the child. What is the cause? It is mainly the vitamin A deficiency. Now when I say vitamin A deficiency, the child can either present only with the visual signs or it can be the associated like retarded growth, etc. Hence, when it is a combine of all the signs, we conclude it as to be the vitamin A deficiency. If at all the child is only with the bite out spots, so we can say bite out spots due to vitamin A deficiency, xerophthalmia due to vitamin A deficiency. So we conclude that the case is due to vitamin A deficiency. Now what this vitamin A is? Vitamin A is a fat soluble vitamin present in its active form in the food of animal origin only. But the pro-vitamin form is the beta carotene which is present in the plant tissues. We know that vitamin A is an essential nutrient which is required for the vision, the lung health, bone strength, integrity of the epithelial cells, reproduction, growth and immune response, etc. Now this vitamin A occurs in three biologically active forms, that is retinol, retinal and the retinoic acid, which are collectively known as the retinoids. We know that the provitamin form is the carotene, which is mainly seen in the plants, which belongs to a class of chemicals called carotenoids. Now coming to the sources, before getting into the details of how the biochemical basis of the presenting signs of the child, let's see a little in detail about vitamin A, the dietary sources, animal sources and the plant sources. The best of the animal sources are the fish liver oils like cod liver oil, shark liver oil, liver, kidney, egg yolk, milk, butter, cheese, etc. When it comes to plant sources, they do not contain the active form of vitamin A, but then the provitamin, that is beta carotene. This beta carotene is rich in all yellow and the orange colored fruits and vegetables like tomatoes, carrot, papaya, mango, etc. Coming to the recommended dose. Now, this 5,000 international units can be given in a case of vitamin A deficiency. But when it comes to the routine recommended daily allowance, children, it is around 400 to 600 microgram per day or 1300 to 1600 international units per day. Men, it is 800 to 900 microgram per day or 2600 to 3000 international units per day. Women, 700 to 800 micrograms per day, or in the international units it is 2300 to 2600 international units per day. During pregnancy and lactation, it is the extra allowance is recommended of the daily recommended allowance, that is around 3300 to 4300 international units per day. That is the extra of 1000 to 1300 micrograms per day is recommended. So coming to now, when I say vitamin A, is it stored in the body? Yeah, some amount of the vitamin A is stored as the retinyl palmitate. Small amounts is also stored in adipose tissue lactating breast, adrenals, lung, and intestine. As and when it is required, this is released and utilized. Now we know the various functions of the vitamin A, that is, it has an important role in vision. You all know the details about the role of vitamin A in vision, that is about the Waltz visual cycle, what is the mechanism, what is the pathway of the role of vitamin A in the Waltz visual cycle. Now, other biochemical functions, we know that vitamin A has an important role in growth and differentiation of tissues. Now, what they do is they regulate the protein synthesis and thus involved in the cell growth and cell differentiation. The retinoic acid is required for sulfation of the mucopolysaccharides in the matrix of the bone and cartilage. Hence, the role of the vitamin A in bone strengthening, growth and development. The vitamin A also has a role in reproduction. Now, how does it do? It is responsible for spermatogenesis in males and prevents fetal resorption in case of females. Many a times in vitamin A deficiency, miscarriages were noticed in female rats during certain studies which were conducted. Then, vitamin A also has a role in epithelialization. This retinoic acid keeps epithelial tissue in healthy condition. Deficiency of vitamin A leads to keratinization of the epithelial tissues of the skin, respiratory mucosa, gastrointestinal system, genitourinary tract, affecting their normal functions. And the other important function is antioxidant property. The provitamin form or the carotenoids show natural antioxidant property by removing the peroxyl and free radicals and oxidants from tissues under anaerobic conditions. So these are the important functions for us to know before understanding the biochemical basis for the presenting signs and symptoms of the case. So coming to the biochemical basis of the presenting signs of the boy over here. Now he presents with chronic cough, retarded growth, burning micturition, diarrhea, inability to read in poor light. So all these together we can correlate with the functions of vitamin A. So there will be keratinization of the epithelial tissue of the respiratory system leading to chronic cough, GI system leading to diarrhea, then genitourinary tract leading to burning micturition, and also retarded growth because of vitamin A deficiency, which has a role in the growth and development and differentiation of the cells. And also he has dry and thickened skin, again due to the vitamin A deficiency, which leads to keratinization of the cells of the skin. So that is how the boy presents with all these signs and symptoms due to the vitamin A deficiency. Now the other one is the boy was malnourished. Again, malnourishment can lead to various nutrient deficiencies, hence leading to vitamin A deficiency. Then grayish white spots were seen on the conjunctiva and the conjunctiva was dry. Now what are the deficiency manifestations in the eyes? Let's see one by one. Here what the boy presents with is mainly the grayish white spots on the conjunctiva and dry conjunctiva. The vitamin A deficiency can present with night blindness or the nyctalopia, where there is difficulty for the eyes to adjust to dim light. Again, where you see in this case inability to read in poor light. So affected individuals are unable to distinguish images in low levels of illumination. So people with night blindness have poor vision in the darkness but see normally when adequate light is present. So here what happens is vitamin A deficiency leads to a decreased amount of rhodopsin in the eye as the retinal is inadequate to bind with opsin. Next one is xerophthalmia, which is nothing but the dryness of the eyes. Night blindness caused by vitamin A deficiency is associated with the loss of goblet cells in the conjunctiva, a membrane covering the outer surface of the eye. So what happens over here? Xerophthalmia results from keratinization of the epithelial cells. It involves drying, xerosis, and thickening of the conjunctiva and cornea, which becomes glazy and lusterless, losing its normal transparency. The lack of mucus together with lack of tears not only leads to the dry appearance but also increases the risk of infection. Then comes the bite-out spots, which are seen in the case in the boy over here. They are the slightly elevated white foamy lesion usually seen on the bulbar conjunctiva near the limbus at the 3 o'clock or the 9 o'clock position. Bite-out spots are more common on the temporal side. Now here the white deposits consist of keratin, which the conjunctiva starts to produce because of the deficiency, which has led to squamous metaplasia, with the cells in the conjunctiva becoming more like skin than a mucous membrane. The vitamin A deficiency can also end up with keratomalacia. The most severe form of xerophthalmia is keratomalacia, in which more than one-third of the cornea is affected. Here, the cornea becomes edematous and thickened. In advanced deficiency, cornea becomes hazy and can develop erosions and ulceration, which can lead to the blindness. So these are the visual disturbances due to vitamin A deficiency. Coming to the assessment, how do you assess a case of the vitamin A deficiency? One is dark adaptation time. Here, in case of vitamin A deficiency, dark adaptation time is increased. Then serum RBP levels. Normal serum RBP level is 3 to 6 milligram per deciliter. Well, it will be decreased in case of vitamin A deficiency. Then serum vitamin A levels. Normal blood level of vitamin A is 25 to 80 microgram per deciliter. Here, there is decrease in serum vitamin A level in case of vitamin A deficiency. Coming to the treatment, vitamin A is given orally in the form of capsules for 1 to 6 months depending on the severity of the deficiency, or any stage of xerophthalmia is treated with 60 milligram of vitamin A in the capsule form, and the same dose is repeated 1 and 14 days later. So this is about the vitamin A deficiency, which can manifest with the visual disturbances and also disturbances of other systems like respiratory system, GI system, genitourinary tract, etc. The skin also is involved, where it can be thickened and dry due to vitamin A deficiency.